we go back again. You can't stretch 5 days worth of doctors. Already stretched. There are huge gaps in hospitals across the country.
But is this contract about pay? Is this contract dispute ultimately about pay, which is what those WhatsApp messages seem to suggest?
There are parts of this contract that are about pay, sure, because Jeremy Hunt wants to count weekends as sort of weekdays. He wants to take our weekdays up until 9 in the evening. That's part of it. But the bottom line, we must not forget, it's simple. It's so simple that anyone out there can see this is not going to work. There are not enough doctors. You know, there are 3 doctors on surgical takes covering 6 doctors. Do you think that's safe for patients?
Well, the Department of Health would say that the highest number of doctors are being employed by the NHS.
The Department of Health is saying 10,000 more doctors. Tell me where they're coming from.
You're not saying.
It's nonsense. It's nonsense, I'm sorry, but I don't buy it. There aren't any doctors. Where are they getting them from? None of us know about these 10,000 doctors. 10 billion going towards the NHS, that's a drop in the ocean. You know, we're told about 8 studies about the weekend effect. Well, there's plenty of research that shows it doesn't even happen.
So where does this end?
I think it ends when the government sees that this needs to be another U-turn. They've U-turned on a lot of things in the last year, let's face it, a lot of things. This is not going to work. They need to U-turn on the 7-day NHS until they get adequate evidence that shows they can fund it, they can staff it, and they need to show that to the NHS staff. Because otherwise we can't work in that system. We are going to put our patients at risk. And yes, strikes are not the right thing to do, but we have to draw a line.